Good afternoon, everyone. Namaste from Nepal. I am Dr. Ramila Shilpkar, medical oncologist at National Academy of Medical Sciences. And today I will be sharing my experience with triple negative breast cancer from Nepal. Breast cancer is the most common cancer among women in Nepal, which accounts for 17.1% of the total cancer cases, according to Globocan 2020 data. And it accounted for 7.7% of all cancer-related deaths. Triple negative breast cancer is the subtype more common in younger women and poses unique challenges in the management. So we did a retrospective analysis of the available case records in the three cancer centers, National Academy of Medical Sciences, Bir Hospital, Bhaktapur Cancer Hospital, and National Hospital and Cancer Research Center from 2013 to 2019. However, due to rearrangement of our file records, which is handwritten file records post-earthquake in the 2015, there was a limited review. So we reviewed total cases of 788 cases, out of which 65 patients were triple negative breast cancer. HER2 score indeterminate in IHC was in 28 cases, in which FISH was not done for confirmation. HER2 testing was not done in 34 patients, so it led to triple negative breast cancer of 8.3%. So as we can see, the mean age at diagnosis is 48.8 years, with the range being 23 to 75 years. And all the patients were female, with 7 patients having family history of breast and ovarian cancer, and 6 patients had been sent for genetic evaluation. There was no patients who were pregnancy-associated breast cancer. So in the right side, we can see the bar diagram in which we can see the most common age range being 41 to 50 years, followed by 31 to 40 years, and 51 to 60 years. This is the stacked bar diagram in which we can see the most common stage of presentation was stage 3C, followed by 2A, 2B, and 3A. So we can also see the grade of the tumor across all different stages. The grade 3 high-grade tumor was more common, followed by grade 2. So 9 patients received neoadjuvant chemotherapy, in which TAC regime was the commonest regime used, and 2 patients got grade 3 hematological toxicity following that. The non-hematological toxicity diarrhea was present in 1 patient, and for all patients following neoadjuvant chemotherapy, contrast-enhanced computed tomography CT scan was the imaging modality done because of unavailability of PET scan in the country as well. We can see the most common type of surgery done was the modified radical mastectomy in 76.5% of the cases, followed by breast conserving surgery in 20%. Most common pathological stage following surgery was 3C, followed by 2A, 2B, and 3A. Lymphovascular invasion was present in 34 patients, whereas margin positive status following surgery was present in 2 patients, and extracapsular invasion was reported in 3. 62% patients got adjuvant chemotherapy, in which TAC regime was used in 24 patients, followed by ACT regime and CAF and FEC regimes. So the number of chemocycles for TAC was 6 cycles, 8 cycles for ACT regime, and few patients got 5 and 3 cycles who got partial cycles in neoadjuvant chemotherapy. Grade 3 hematological toxicity was recorded in 21.5% of the cases, while non-hematological toxicity was reported in 1 patient. The adjuvant radiation was delivered in 45 patients, in which 50 gray was the commonly used dosing. So coming to the sites of relapse, the distant relapse was seen in 6 patients. Local and distant relapse was reported in 3 patients, and local relapse in 1 patient, out of which the distant metastasis site, the most common site was bone in 3 patients, whereas The other distant metastasis sites were liver, nodes, skin, and brain. Coming to the final outcome of our patients in our retrospective review, 9 patients has been reported as has death after the during the follow-up, whereas 36% patients, accounting for 55.4%, are still alive without any disease. And 6 patients are alive with disease, and 1 patient defaulted treatment, whereas 13 patients, accounting for 20% of the patient, has been lost to follow-up. So in conclusion, triple negative breast cancer is the common cancer in younger women with mean age of incidence 48.8 years in Nepalese population. Neoadjuvant chemotherapy in locally advanced triple negative breast cancer is still not widely used in Nepal. Modified radical mastectomy is the common type of surgery done. Now, there is a good survival despite late presentation of the disease in majority of the patient who complete treatment. Loss to follow-up is a major issue which needs urgent attention in our setup. And finally, medical record quality improvement seems to be a priority area in Nepal for generation of local, reliable, and quality scientific data. Thank you. I'd be happy to take any further questions.